probably all of the world quite soon, it won't return. Why won't it return? Well, they've got T-cell immunity. We know this, it's been studied by the best cellular immunologists in the world. Sometimes people will say, well, it looks like the immunity is starting to fade. You'll sometimes see things like that. And when I saw the first headline like this, I remember being really quite confused, because that's not the way immunology works. Just think about it for a moment. If that was how it worked, it could kill you and you had to fight it off, and if you had successfully done that, it somehow didn't leave a mark in your body. Well, it does leave a mark in your body. The way you fought it off involved certain pattern recognition receptors and has left you with, as it were, memory cells that remember what it was they fought off. And if they see that thing again, it's very easy for them to get those cells to work again in minutes or hours, and they will protect you. So the most likely explanation is it'll last a long time. So I read a bit more about this so-called tailing off of immunity, and I realized they were talking about antibodies. Just incorrect to think that antibodies and how long they stay up is a measure of immune protection against viruses. I mean, you can tell I don't agree with this. It's just, there have been some classic experiments done on people who have inborn errors in parts of their immune system, and some of them have inborn errors that means they can't make antibodies. And guess what? They are able to handle respiratory viruses the same as you and me. So I don't think it's harmful to have antibodies, although some people are worried about the potential for amplifying inflammation from antibodies. But my view is that they're probably neutral, and you definitely should not believe the story that because the antibody falls away, you've lost immunity. Again, that's just not the way the human immune system works. The most likely duration of immunity to a respiratory virus like SARS-CoV-2 is multiple years. Why do I say that? We actually have the data for a virus that swept through parts of the world 17 years ago called SARS. And remember, SARS-CoV-2 is 80% similar to SARS. So I think that's the best comparison that anyone can provide. The evidence is clear. These very clever cellular immunologists studied all the people they could get hold of who had survived SARS 17 years ago. They took a blood sample and they tested whether they responded or not to the original SARS, and they all did. They all have perfectly normal, robust T-cell memory. They were actually also protected against SARS-CoV-2 because it's so similar, this cross-immunity. So I would say the best data that exists is that immunity should be robust for at least 17 years. I think it's entirely possible that it is lifelong. The style of the responses of these people's T cells were the same as if you've been vaccinated and then you come back years later to see, has that immunity been retained? And so I think the evidence is really strong that the duration of immunity will be multiple years and possibly lifelong. There have been but a tiny handful of people who appear to have been infected twice. Now they're very interesting, and we need to know who they are and understand them very well. They've probably got certain rare immune deficiency syndromes. So I'm not pretending no one ever gets reinfected, but I am pointing out that it's literally 5 people or maybe 50 people. But the World Health Organization estimated some weeks ago that 750 million people have been infected so far by SARS-CoV-2. That means most people are not being reinfected, and I can tell you why that is. It's normal. It's what happens with viruses, respiratory viruses. Some people have called for zero COVID as if it's some political slogan. And there are some people I've heard calling for it almost every day. They're completely unqualified to tell you anything. Something that's really important to know is that SARS-CoV-2, it's an unpleasant virus. There's no question about it. But it's not what you were told in spring. We were originally told that it would kill perhaps 3% of people it infected, which is horrifying. That's 30 times worse than flu. We always overestimate the lethality of new infectious diseases when we're in the eye of the storm. I believe the true infection fatality ratio of COVID-19, the true threat to life, is the same as seasonal flu. So there's no reason why you would want to try and drive COVID to zero. It's a nonsense. That's just not how biology is. And all the means I have heard proposed as ways to get us there are much more damaging and pathological, I would say, than the virus itself. It's simply not possible to get rid of every single copy of the COVID-19 virus, and the means to get you there would destroy society. Forget the cost, although it would be huge. It would destroy your liberty. You would need to not go out until you've been tested and have your result back. And I have described how the false positive rate would just destroy it from a statistical perspective. So I don't believe it can be done. It's not scientifically realistic, it's not medically realistic, and it's not what we have ever done. As the virus swept towards the UK in the late winter and early spring, I too was concerned, because at the time we were told perhaps 3% might die. So when the Prime Minister called for a lockdown, I wasn't pleased about it, but I understood that we should try this. But it's important that you understand that when we look at the profile of the pandemic as it passed through the population, that it was clear that the number of infections every day was falling. We'd passed the peak quite a long time before lockdown started. So we took all that pain, that lockdown pain, which was multiple weeks, I don't remember exactly how many, multiple weeks, we took it for nothing. If there was a really important effect of lockdown on the number of people who died or the rate of it, you should at least be able to order them, like these people had lockdown and these didn't. And you cannot. All heavily infected countries' shapes are the same, whether they had lockdown or not. They don't work. I don't